So basically, one of the main things that we're really interested in my lab is thinking about how does myeloma that becomes resistant to proteasome inhibitors, what else changes in the cell? How does that create new therapeutic vulnerabilities, if you will, that we can then go after specifically in the context of disease resistance? One thing we found and we published last year is that the myeloma surface proteome in the context of proteasome inhibitor resistance does change quite dramatically. Unfortunately, though, we didn't find any really highly specific immunotherapy target in that context. So one thing we're really focused on now in terms of thinking about, historically we thought about to overcome proteasome inhibitor resistance, what are other intracellular targets that we need to go after inside the plasma cell that could be changed in the result of proteasome inhibitor resistance. Now we're much more focused on thinking about, even for BCMA, as an example, for BCMA CAR T, it appears to be highly efficacious versus proteasome inhibitor resistant disease. So recently we published a review where we really discussed this concept of, do we need to focus on that very specific biology of proteasome inhibitor resistance anymore, or is the question actually a little bit moot? Do we just want to find therapies that are effective against this disease context, but then also that's why we're moving to focus on, well, once you become resistant to an immunotherapy, then what are your next angles, basically? Because we know the existing immunotherapies are very effective against proteasome inhibitor refractory disease.